Show me. Thank you. Okay. So first, we use the piercing to attach the gum, separate the tuberosity from the root.
As much as we can.
But, you know, the first time we can see the anesthesia is working. It's not painful. We go distally behind it and we push the tuberosity away. I'm pushing it away. I feel it. It's going away. Then the chance my fracture tuberosity is coming. Okay. Okay. It's good. Thank you. I go when I feel there is a bone, echo movement. That's a tooth loose. The tooth is loose. Okay, can you see?
Yeah.
Okay, Victoria, get forceps and you extract it.
Like you need 2 forceps.
Yeah, this one is fine. This one is fine. Okay, come on. You can stand here and you do that. Okay. Reflection. So reflection one side, and you can use your fingers. It's fine. Okay, and the forceps forceps this way, and reflection this way. Okay, grab the tooth. Okay, grab the tooth.
Sliding off.
I know it's sliding, but rotation.
I can't grab it.
You can use the other one if you like.
Yeah, I think maybe.
You got it?
I don't know.
Keep it slipping.
Kinda?
Yeah.
Okay.
But I can feel that you're grabbing something.
It's grabbed, but
Yeah.
I can't really.
Go luckily.
I'm like rotating it, but it's not really coming out.
Yeah, let's go luckily. Oh.
Yeah.
Want me to try? Give it up.
Not that I give up, but I don't
Yeah,
think.
try again. Try more. I want you to learn.
There you go, it's slipping.
Come on. Why is it holding on for dear life?
Okay.
Go with it.
It's so in there. Oh my god, Zane, I hate your fucking tooth.
I can feel this other space.
Yeah?
So كل ما we delay, the trauma will be more delayed. The tissue will be. So as much go faster, easier.
I'm trying.
I'm trying. You want me to move it more for you?
Maybe.
All right. All right. Okay, Victoria, now. Okay. Thank you. Appreciate it. Feel like Tyson? Good job. Very nice. Suction.
Oh.
We have a mirror. Look for something here. You can see there's here. There's destruction or anything. There might be suture. Everything looks fine. Here I can see everything fine. Okay. And so the gauze, very small gauze, and we have بكلي للجاج ريفلكشن فيخليه اضغط قوي قوي so pressure on it بيروح على جهة الخلف فقط